as far as I'm concerned. Thank you so much for taking a half hour out of your life to find out about something that I think is incredibly important for women, especially women that are either going into menopause or who are menopausal. So I'm going to start out by asking you a question. Tell me what you guys know about osteoporosis, osteopenia. What have you heard? What do you think? What do you believe about it? What do you know about it? Anybody?
The bones are brittle.
Yeah. Brittle bones, okay.
They break easy.
Anything else? Nothing else?
Prone to falling because your bones are getting weaker.
Okay. Okay. What do you do about it? Anybody hear anything?
Your diet.
Okay.
Eat green, dark green vegetables.
Okay, good. Yeah, we're going to get into diet a lot, but good answer on that. Yeah. Anybody else have any thoughts on it?
I'd say exercise is probably one of the better things you can do to help prevent it.
Okay, good answer. Yeah. So let's get into this tonight. I want to. The reason I do these talks is there's a lot of misinformation out about this subject. A lot. Okay. I want to straighten that out tonight. I want to give you guys facts that you can actually use and that you can take home with you. You got some notes tonight, which is good. And so let's look at bone basics. Bones are primarily made of collagen. Now, remember this word because this is going to be the last thing we're going to talk about tonight. Really, really important. Collagen provides a framework for making your bones. Strength and hardness comes from calcium phosphate. Your bones are the primary storage site for calcium. So when your body needs calcium, where does it get it from?
Your food, your diet.
Well, yeah, but if you don't not getting it from your diet, where's it going to get it?
Supplements.
Pulls out of your bones. Okay,
Teeth.
it's going to get out of your bones, right? Osteoclasts are cells that remove old bone tissue. Osteoblasts create new bone tissue. And your bone has two layers. The outer layer is called the cortex. It's cortical bone. It's really hard. The inner layer is like a honeycomb, okay? And your bone is considered to be an endocrine organ. It actually helps regulate blood sugar. So if you have poor bone health, what do you think that might do to your blood sugar? Might not regulate it. Might not be regulated so well, right? So here you have osteocalcin is produced in the cells of bone, which affects fat cells and beta cells, and it improves the body's ability to handle sugar and keep fat mass low. So osteocalcin interacts with the beta cells of the pancreas and the fat cells to improve the body's ability to handle sugar. So if your bones are if the metabolism of your bones is off, it may cause weight gain and blood sugar rise in blood sugar, and you don't know why. Okay, how many of you knew that before tonight? Yeah, probably nobody. Okay, because nobody ever tells you this stuff. Here's a picture of some bone. Here's the cortex. Here's a cancellous bone. Here's a bone marrow. You see, it's got both arterial and venous blood supply. Healthy bone does. So bone integrity. The strength of the bone depends on the quality and quantity of bone tissue. So the bone quality is influenced by a lot of factors. You know, the architecture and geometry of the bone turnover, mineral availability and usage, and collagen. Okay, so where do we get the minerals to make our bones strong?
From our diet?
We should be getting it from our diet. Yeah, it's from what we eat, okay? I mean, we don't breathe the minerals in, okay? We eat them or drink them, all right? Stressing the bone via mechanical forces increases strength and what we call collagen cross-linking. What are we talking about here when I talk about mechanical forces? How about
walking?
Yeah, anybody here
weight bearing.
ever heard of exercise?
Yeah.
Yeah, it's exercise, right?
Riding a bike.
Okay, yeah. So AGEs, that's known as advanced glycan end products, accumulates in bones, resulting in the loss of integrity of the bone. Now, what is an AGE? Does anybody know what an AGE is? Okay. An AGE is what happens when you eat a lot of sugar, and part of the sugar, the fructose part of the sugar, gets shunted into your liver, and it hooks up with protein. And it's a very cheap form of protein. Okay. It's called advanced glycation end product. Okay. People that eat a lot of sugar, you ever notice that that sugarholics have more wrinkles than other people? Okay. But you know why that is? Is because of this, AGE. The part of the sugar, the fructose part of the sugar, goes in the liver. The liver hooks it up with protein. That protein becomes part of your tissue, but it's a cheap, really cheap form of tissue. Okay, so that's why staying away from sugar, really, really important. It's really important in bone health too. Now, look at this. Bisphosphonates, which is what we're going to talk about a little later on the talk, which is what are prescribed for osteoporosis, is also correlated with AGE accumulation. Pretty interesting. How many of you hear that on how many times does Sally Fields ever tell you that on the bisphosphonate commercials? Yeah, I've never heard her say anything about it. Okay? Now, this is a bone remodeling process. So here's what happens. You have normal bone here, but bone gets old, just like the shingles on your roof get old, okay? And so, instead of covering up the shingles, the old shingles with new shingles, okay, which is really hard on the foundation of your house, all right? You strip the old shingles away and you put new shingles on. Well, your body does that too. Osteoclasts strip old bone away. Osteoblasts bring in new bone cells to give you new bones, so that your body's constantly tearing down old bone and putting new bone in. That makes perfect sense to me. Does it to you? Okay? Now, if you look at aging bones, why do bones age? They age because of a lot of reasons, okay? Sedentary lifestyle, okay? Now, I know none of you have that, but there are some people out there that do, okay? There are some people out there that don't exercise, all right? Poor nutrition, okay? So what would poor nutrition be?
A lot of sugar.
Yeah,
it's the stuff we eat over Christmas, right? That's poor nutrition,
Pizza.
okay? Loss of collagen. We'll talk about that a little later. Hormonal changes. Now, that's something that everybody goes through, okay? Displacement of calcium in the bloodstream. Okay, so aging bones, when calcium gets shunted into the blood, okay, that causes bones to age when it shunts more than it should. What causes that, by the way? What causes shunting of calcium into the blood? Eating too much acid food, okay? Now, the alkaline water that we provide for you for free, okay, if you're a patient at least, that's alkaline water, and what that does is that helps stop this process right here. Okay, it alkalizes your body. But you need minerals. Your body needs minerals. If your blood does not contain enough alkaline minerals, which is calcium, magnesium, potassium, and sodium, and you don't get that sodium from table salt, by the way, okay, just so you know. All right, those four minerals, it doesn't have that. What'll happen is your body will pull calcium out of the bones to make sure that you have that in your blood, which can make bones brittle, okay? Now, here's another thing that I want you to understand. Calcium and phosphorus in the body must be maintained in very specific balance. Too much phosphorus in the diet pulls calcium out of the bones. Where does too much phosphorus come from? I gave you a picture of it up there, okay? Soft drinks, okay? All these soft drinks contain phosphoric acid. So every time you drink a soft drink, you're putting phosphorus into your body, which is going to pull calcium out of your bones, because the phosphorus-calcium ratio in your body is 2.5 to 1. So if you want to make sure that you and your kids, especially your daughters, have brittle bones when they get older, man, give them lots of this while they're growing up, man. Give them Coca-Cola when they're teenagers. You know, when they're trying to build that bone, give them lots of soft drinks. That will, you are absolutely guaranteeing that their bones aren't going to be as healthy as they need to be as they get older. You're guaranteeing it, okay? This is one of the reasons I hate soft drinks so much. One of the worst things you can put in your body are soft drinks. I don't even allow it in our house. We don't drink them. They're just so bad for you. But if you want to drink, you know, if you want to drink them, knock yourself out, okay? You're just not going to be very healthy. So, osteoporosis and osteopenia, thinning of bones, is it's a natural process. I mean, when we age, you know, how many of you have noticed that we get wrinkles when we age? Yeah, I look in the mirror, I can see it, okay? You know, there's lots of things that happen. My hair isn't as thick as it used to be. It's starting to get gray. These are normal aspects of aging, okay? This is not a disease, okay? So osteoporosis and osteopenia is not a disease, but it's been marketed like one from the pharmaceutical industry because they've got pharmaceuticals they want to sell you, okay? So we're going to talk about why this is so important that you understand this and how to keep your bones healthy without that. All right, so let's talk about osteoporosis. Now, osteoporosis is when your bones get so brittle that they actually start to fracture, okay? So osteoporosis of the spine, sometimes you've heard of people that step off a curb and you know, one of their vertebrae collapses. Okay, that's osteoporosis. Or they step down too hard and their hip fractures and they fall over. That's osteoporosis. Okay, so what happens, this is a silent systemic bone disease. You know, the body's either losing too much or making too little. It causes fragility of the bones. When you see osteoporosis on an x-ray, you know that you have at least 50% bone loss when you see it on an x-ray. Now, when you see a lot of things on x-rays, that means that things are pretty far down the road, okay? So if you see like cancer on an x-ray, bad news, okay? You see degeneration of a joint on an x-ray, that means it's probably been doing that for the last 20 or 30 years. So x-rays are a great tool, but when you see things, when you see disease processes on an x-ray, it means they've been there for a while. Approximately 1 in 2 women over 50 will have osteoporotic fracture and 1 in 4 men. And we want to prevent that with all of you and everybody listening on Facebook Live right now. So what are the risk factors? Early menopause before 45 years have increased. You have a higher risk in white and Asian women because they tend to have smaller bones, more so than Hispanic and African American women. The issue with African Americans is that because of their dark skin color, they don't have near the vitamin D that they should, and that's why you've heard in this COVID crisis that African American men and women get it worse, they have it more. It's because the vitamin D levels are lower. It's not because it's a racial disease, okay, like some people have tried to make it out to be. In 2 weeks, we're going to talk about, is the COVID talk in 2 weeks? I think it is. Yeah, we're going to talk about all this in 2 weeks, okay? We're going to talk all about COVID, and I'm going to tell you a lot of things that you probably don't know about it. So, diabetes is a risk factor. Heavy drinkers, smoking is a risk factor. So, these people go to bars and smoke and drink, you know, that's osteoporosis in the making right there. Sedentary lifestyles, some medications, we're going to talk about that in just a minute. Nutrient deficiencies, low body weight, previous fractures or family history, and we're going to talk about glucocorticoids here in just a minute. Let's talk about the pharmaceuticals that cause osteoporosis. Did you know that a lot of people take pharmaceuticals that actually cause osteoporosis? I mean, that should give you pause, okay? So let's see what they are. Here's drugs that reduce bone mineral density, steroids, okay, so like prednisone, breast cancer drugs, prostate cancer drugs, heartburn drugs, like, what are the heartburn drugs?
Prilosec.
Prilosec, yeah. Over the counter, okay? Okay, why does Prilosec cause osteoporosis? Anybody? Adam, you know that one, or?
It reduces the stomach acid so you can't digest the food as well.
Exactly. So you have to have adequate stomach acid to digest or to absorb minerals like calcium, magnesium, potassium. So it reduces stomach acid. You can't absorb those minerals. Okay. Depo-Provera. What is Depo-Provera? Anybody know?
It's a birth control.
Exactly. Birth control. It's nasty when it comes to reducing bone mineral density. Anti-seizure, mood-altering drugs, diuretics, acetaminophen, good old Tylenol. I know none of you have ever taken that, but for those who have, okay, it does reduce bone mineral density, okay? All right. The role of estrogen. Estrogen helps keep bones strong. Now, you have to have enough. You don't want too much estrogen. I'll tell you why in just a little bit. But it plays a role in maintaining collagen. At menopause, estrogen levels decrease. It can weaken collagen. So collagen is a connective tissue in our body, all right? May result in 25% of bone loss within the first 10 years. If bone health is not optimal before menopause, women have a greater risk for developing osteoporosis. So what would make bone health not optimal before menopause? Anybody? Coca-Cola, okay? Coca-Cola will, okay? So sitting on the couch, all right? So those are things, you know, eating junk food, taking Prilosec, all of those things, all right? Now, here's some testing options that I use in the office. I'm not going to go over all of these. A lot of this stuff, not all of it, but a lot of this stuff is on my comprehensive panel that I do, comprehensive blood panel. My favorite test for evaluating a woman's health and her bone health is this test right here. It's a bone health panel. It's a great test. And that's this right here. So I'm not gonna go over this in great detail, but this first test, the Prilosec, tells me how the bone is doing. The higher this number, the worse the bone. Okay, so the worse, the more you're heading towards osteoporosis. So if that number is high, then we need to do some things. Then it tells me a lot about what's going on with hormonally. So estradiol, which is the major form of estrogen, if I'm dealing with a menopausal woman and this number is high, that's cancer waiting to happen, okay? You need some estrogen for sure, but you shouldn't have too much. If that number is high, I know that woman is heading down a cancer road, okay? We need to find out why it's high, all right? And then down here, the cortisol, gives me a little peek into what's going on with your adrenal glands. And your adrenal glands are important in menopause because that's what gives you estrogen as your ovaries tend to fade out of the picture. So this is a great test for female health right here. Now, Dexa Scan issues. How many of you have heard of the Dexa Scan? Most of you. Some of you probably had one, okay? That's how they measure bone densities with X-ray. All right, everybody's supposed to have a Dexa scan. So this is the only test for density. It does not test for strength or quality of the bone. Okay, these are very different. Bone density indicates capacity to resist without breaking when being crushed by static weight. However, bone strength is different. So glass is high in density. Okay. And in compressive strength, you can compress glass pretty good before it breaks, but it's brittle and it lacks tensile strength to withstand a fall. Okay, so you can drop a glass and it shatters. Okay, but it's very dense. Okay, so density does not necessarily mean strength, and this is something you have to understand. Okay, wood is very strong and dense, yet it can bend and stretch with external forces, which is what your bones should be able to do. I mean, not bend like, 90 degrees, but it should be pretty flexible. Spider web has a lot of strength, no density, okay? So that's something to think about when you're thinking about bone health. Now, the only thing I want you to understand about this picture, I think this is in your notes, is that when you reach around the age of about 40, that's when you start losing bone. Now, I personally don't think it goes down quite this fast. I think it's more of a gradual decline. Okay, it could with a very poor diet, no exercise, and a solid Coke habit, Coca-Cola habit, go down pretty fast. Okay, bone density in breast cancer. This is something I definitely want you guys to get a hold of this really good. Little known fact, higher than normal bone density in middle-aged women increases the risk of breast cancer by 200 to 300%. I mean, you won't hear Sally Fields telling you that, okay? And by the way, this is the reference. This is PubMed ID. So this is the reference. PubMed is where you go to find all the medical literature that's ever been published. So that's where you could go to get that, and I think you have that reference in your notes. This didn't discuss because it doesn't fit the narrative for the Osteoporosis Foundation, okay? Solutions for either are drug, surgery, and radiation, which, I mean, I don't think anybody wants that. Losing bone mineral density is a normal part of aging. Goal is to increase the strength of the bone, not necessarily the density, okay? So here's some other things that that you want to understand. Bisphosphonates is a class of drugs that use it to treat osteoporosis. You've heard of all these. Fosamax, Boniva. I haven't heard of the rest of these as much. Boniva, that sounds like a Caribbean resort or something, to me. But, and so Fosamax sounds like a boxer. But anyway, these are some of the drugs that what they do is they make the bone dense. And the way these drugs work is they restrict bone breakdown. So the osteoclasts, they keep the osteoclasts from breaking bone down. So what happens is you get old bone on top of old bone on top of old bone. So you go in and the bone density is better, but what you've got is a lot of old bone, okay? Like a lot of bad shingles on your roof, okay? That's really what you're seeing. All right. Now, how they work is they actually decrease bone quality and strength. Let's see. I think that I've pretty much covered this already. Here's something that you want to know. They recommend that you take these drugs long term. 94% of women taking bisphosphonates for greater than 5 years had femoral fractures. So that isn't very good. I mean, if chiropractic were doing this, we wouldn't even be allowed to practice, okay? But again, you don't hear Sally Fields saying that stuff, okay? Here's the side effects of bisphosphonate. You've got those in your notes. Can you imagine that you're taking these drugs and having abdominal pain and then flatulence in public on top of that? I mean, that's beautiful, right? Or you got diarrhea and constipation, on top of that. I mean, why would anybody want that? Okay, but these are the side effects, okay? And then, dental problems, you lose your teeth. I mean, who'd want that? Now, what are some of the things that we can do to support bone health? First of all, most people in America don't eat well and they don't exercise enough, okay? So, healthy bones need the right nutrients. They need to be stressed, okay? What are some of the nutrients that bone need? With the minerals, anybody?
Calcium.
Yeah, calcium.
Phosphorus,
Calcium, magnesium.
vitamin D.
Yeah. Manganese, copper, zinc,
Iron,
selenium. Yeah.
iron,
The whole array of minerals. Okay? They have to be stressed via exercise. You cannot have healthy bones without exercise, okay? Refined foods make bones weak. sex hormones play a role in maintaining bone health. So how can we, as you age, keep your sex hormones high enough to where they're keeping your bones and the rest of your body healthy? How do you do that?
Eat more pork, eat more green, leafy vegetables. Mixed vegetables is a good one.
Well, I wasn't thinking about pork.
Pork's high in zinc and
yeah, it is. It is high in zinc. Okay,
good for you.
it's good. It's high in zinc. The thing I was thinking about here was your adrenal glands. You keep your adrenal glands strong. Okay, so so you manage your stress. Take things that help adrenal function. Vitamin C is one of those. There's other things. I have a whole slew of things for adrenal gland function. But that's how you keep your levels of estrogen, progesterone, and other hormones normal as you age. They come from your adrenals. Dietary recommendations. Here's some things you can do. Nettle tea. There's a lot of minerals and silica. Rosehips tea, mineral silica, and vitamin C. Okay? Asparagus, cucumbers, and artichoke, you have minerals. Raw dairy, okay? Raw here is the key.
Yeah.
Okay, it's the key. All right, now, the Mediterranean diet is shown to improve outcomes related to hip fractures. So you can look up what the Mediterranean diet is. High calcium foods, green leafy vegetables, collard mustard greens, sesame seeds, almonds, cashews, walnuts, all high in calcium. Drink hard water. So the water in there is pretty hard. It's not soft water. Increased consumption of phytonutrient-rich foods, which we get from where? Where do we get phytonutrients from? Don't tell me pork. Okay. From fruits and vegetables, right?
Yeah.
Green tea, fruits, vegetables, things like that. Okay? Okay, red grapes, dark chocolate, hallelujah,
Yay.
dark chocolate. And blueberries are a source of resveratrol, which increase bone alkaline phosphatase. I'll tell you why that's important in a second. So, for me, of these three, I eat red grapes in season, but blueberries, I put blueberries on my salad every day, okay? Dark chocolate, yeah, eat it, okay? Just make it low sugar dark chocolate, okay? Now, let's talk about phosphatase. This is really, really important. It's an enzyme found in three important foods: bones, raw dairy, and unprocessed grains, okay? So you don't find this in Cheerios, all right? Phosphatase is an enzyme required to extract calcium from food and vitamins from grain to incorporate into bones. Pasteurized dairy and processed grains have no phosphatase. Okay, so like bone broth would be really good for this, okay? Raw dairy products, unprocessed grain, everything hasn't been milled out. Here's the standard processed products that are high in phosphatase. Prostex, which was for the prostate, Ovex for the ovaries, and Biost, which is for bone health. These are the standard processed products that are high in that. Lifestyle recommendations for osteoporosis: get enough sleep, reduce stress, avoid smoking and excess alcohol. And if I had the time, I could tell you exactly how each one of those pulls calcium out of your bones, but I don't have time to do it. Light walking 4 hours a week has been shown to significantly reduce hip fractures. Just light walking, but you got to do it 4 hours a week. Weight or balance training is important. I mean, I tell all my patients to do this, okay? Whole body vibration, that's what those vibe plates, you've seen those. I bought my wife one of those for her birthday this year, and you exercise on them. It really makes a big difference with bone health. And strengthen bones when you're young to have more available when you're older. It's like putting money into a savings account, okay? And when you do that, that way, when you reach menopause, your bones are a lot stronger. When you drink soda pop when you're young, it's like pulling money out of your savings account It's like charging up a credit card that's going to have to be paid back. So, you know, when it comes to your kids, grandkids, don't give them pop. Okay, herbal and nutritional support to help protein breakdown is really important. So Zypan and Digest Forte are some that I use. Calcium lactate and Biost. And another one I like a lot is Bone Complex because it contains natural estrogen. These are all standard processed products. Hormone-specific support, Wild Yam Complex, really good for that. The rest of these are all good for both men and women. Now, the last thing I want to talk about is the role of vitamin C. This is so important. Vitamin C is really important for building collagen, okay? So it guides the remineralization of bone. It stimulates the growth of osteoblasts, which make new bone. Prevents excessive osteoclastic activity. Essential in collagen synthesis. So if you have osteoporosis, one of the things that you need is vitamin C. It's not just calcium and vitamin D. You've got to have a whole food complex vitamin C, like the Cataplex C that we have here. Multiple studies have shown that elderly people with fractures had significantly less vitamin C in their blood. Without vitamin C, D, and K, the bone matrix is unable to incorporate calcium. So we get vitamin C from fruits and vegetables, right?
Mm-hmm.
So you know, we keep coming back to that. Mm-hmm. So that's all I have tonight. I would like to say this: if you know of somebody that has osteoporosis, or that may be thinking they have it, they're struggling with it, and they want some help, that would be a great person to send in for this female test that I have. That would be an ideal test to perform on
I'll
that.
go to the bathroom.
Yeah, go ahead, Patricia. So, if you know of somebody, and you probably do, send them in and have them talk to me, and maybe we can really help them prevent osteoporosis and osteopenia, and down the road. Because I'll tell you what, that test is a lot cheaper than having a hip fracture and having to have your hip pinned later on, and all the other things that go with that. So, any questions about?
I do. On
yes.
vitamin K, how does that got to do with your bones? You know, I know it's got something to do with blood clotting, and there's a few other things that people that are low in vitamin K, they got to take a shot every month, especially diabetics.
Yeah, it helps you absorb nutrients a lot better.
Okay.
Yeah.
Another question I have is, why do dentists